Jamaica may be staring down the barrel of a burgeoning healthcare crisis as childhood obesity rates have doubled along with the risk of childhood hypertension. Those matters were the focus of a discussion where experts concluded it's time for action. Ramon Gordon was on location in the corporate area for the forum.
Jamaica is now facing a looming health crisis as childhood obesity rates continue to climb. Clinical nutritionist at the Caribbean Institute for Health Research Care, Dr. Susan Suarez Winter, shared the findings Tuesday at an editors' forum examining the urgent need for exhaustive food regulations in Jamaican schools.
At least 23% of adolescents are overweight or obese, and maybe even in our Jambar Kids study, we're showing that even 1 in 3 children are overweight. But when children are in schools, you as parents, you're not there to help direct the children to say buy this, buy that. Why are we concerned with obesity and NCDs? There are a lot of other risks. So there are social and behavioral risks. A lot of overweight children are prone to getting bullied. We have anxiety, depression, even poor school performance. So getting a school nutrition policy in place is very important.
Talk of a comprehensive school nutrition policy, SNP, is not new. Back in 2019, then Education Minister Ruel Reid had promised a plan to restrict the sale of high-sugar drinks in schools. The Health Ministry later implemented the initiative, though talks of a more comprehensive SNP have stalled.
We generally understand that the consultation green paper stage is a back and forth between stakeholders. We haven't heard anything since September 2022. We're advocating for implementation in September, but considering we haven't heard anything in almost 2 years, we're not sure what's next.
Similarly, Barbados is facing a parallel crisis, with 60% of the government's healthcare expenditure allocated to fighting non-communicable diseases. The island has, however, been proactive.
We formed a coalition that was quite active of health and non-health actors who really spoke into the issue. You all are experiencing in Jamaica. It takes a while because there are so many considerations from all kinds of stakeholder groups that there has to be that civil society push that talks about the right of these children.
Caribbean countries lead the global consumption of sugary drinks. In Kingston, 86% of students consume an average of 16 teaspoons of sugar daily from beverages alone. Dr. Winter has not ruled out a complete ban.
I think we need to just understand that added sugar really has no benefit to the diet, and it is causing more harm to our children. So having an outright ban, yes, I don't think it's something we should dismiss completely.
An alarming 80% of local deaths are caused by NCDs. That's why the Heart Foundation of Jamaica, HFJ, is advocating for heightened transparency in food labeling practices.
Some of these food and beverage industry representatives, they do have our policymakers in their pocket. It's a non-stop fight, but hopefully we will get there.
Ramon Gordon for CVM News.